I'm Dr. Pauline Lucas. I'm a pelvic health physical therapist, and today I'm going to share with you how to do the I Love You abdominal massage technique. This technique is super helpful for people that are dealing with constipation and with abdominal pain, and a lot of my patients are doing this on a regular basis and getting really good results. In addition to making changes in their nutrition, maybe getting some more relaxation, drinking enough water, etc., etc. But let me tell you a little bit about this particular massage technique. So first of all, the colon starts at the bottom right here on the right side. Just on the inside, when you feel here with your hand, there's like a pointy bone. When you go just to the inside of that, you know, where the area where the appendix is, that's where the colon starts. Then it goes all the way up to where the ribs are. And then it goes across to the other side of the ribs. And then it goes straight down. And there you feel that bony point as well from the pelvis. And then it goes behind the bladder and right here to the center. And then it goes to the anus, or to the rectum and then to the anus. So the massage technique can help in general with relaxation, but also it can support the peristalsis, which is the movement that the colon makes, kind of like a caterpillar. It just kind of squeezes and it moves what we call the bolus or the stool towards its ending point. And sometimes that process, the movement is not as strong. And so with our hands, we can support that. And there's actually quite a bit of evidence for these particular techniques, or at least abdominal massage, to be very helpful. And it's such a simple thing to do. Now, if you plan on doing this, I would say do it every day, about 5 minutes or so, or even a few times a day if you like, but at least once a day, doing this for about 5 minutes can really make a difference. So here we go. This is a particular technique. It's called the I Love You massage, and I'll explain to you why. We start with the end point. So we go from the left ribs down to the pelvis, and this is kind of the shape of an I. Then we go this way, so that would be the L for love. You have to use a little bit of imagination here. And then at the end, we go up, across, and down. So that would be an upside down U. So that's why we call it the I Love You massage. I'll also show you very briefly a simpler method at the very end of the video. So starting right underneath that left rib, the technique is not super important, like exactly how you use your hands, but I'll show you my favorite way. I like to put both the fingertips of both hands underneath the ribs, and I kind of make a downward movement. Now, if you're super sensitive, you might do this a little more gentle than what I'm doing right now. I kind of dig in right here. So I move down and I go all the way down to that inside of that bone of the pelvis, right here. And I repeat that a few times, just pushing down. It's kind of thinking of like pushing the poop down, just like that. And I might do that for like, a minute or 2 minutes. Then after I do that a few times, and again, you can also just do some gentle rubbing like this, or you can do a little tapping, or you can do more of a massage technique. And by the way, if your fingers are really sensitive and that doesn't work for you, something like a little tennis ball or yoga ball can do the trick, just using that to push down. And after you've done this a few times, you can then start at the right side below the ribs for the transverse colon. So this is the descending colon, this is the transverse colon. And now we're pushing to our left side, this way. Now, we often find a tender point or a point where it just kind of feels stuck. And if you feel that, what you might do is simply hang out there for a bit, just holding your fingers on that spot and just taking a few calm breaths. And what you'll often find is that it will start relaxing, and maybe even you hear a little gurgly sound as the stool, the contents of the transverse colon is moving through, and there's some relaxation happening of the bowel. And then we continue our way all the way to the left side, and then from there we go down again. So with this technique, it's kind of like starting with the end. So we go across, and then we go down again, and we do that maybe 4 or 5 times use your intuition here. Just feel what it feels like. And right now I'm sitting quite straight up, but I actually recommend when you do this yourself is that you relax a bit, sit back, relax those abdominal muscles. And so we do this a few times, and then we then we go to the beginning point, which is on the inside of the right side of the pelvis, where you feel that bony point. And so now you're going to move upward, upward, upward all the way to the ribs. And we do that a few times. And then we go across again. And then we go down. So this is that U. So we go up, we go across, and then we go down. I don't really like to massage right in the center because you're kind of massaging your bladder, but you could if you wanted to. So up and across and go down. And again, if you find a tight spot, like I feel a little tightness right here, just keeping the fingers there, relaxing the shoulders, take a few relaxing breaths and see if that area lets go, if it relaxes. All right, after we've done that, I personally like to do a little bit of just rubbing the belly in circles. I call this the Winnie the Pooh, and if you've ever read Winnie the Pooh books or watched movies, you probably know what I'm talking about. And then the last thing I like to do is called acupressure or pressure point of what is called the celestial pivot point. So this is an area, so you look at your navel, and then about 2 finger breaths next to that navel. On either side, you put a finger, just like this. And you push these fingers gently into that area, that spot, that acupuncture point, and either just hold them there, or you can even do very gentle massaging. Just lightly make circles with those fingers. At no point do you do it in a way that is painful. This should just feel quite comfortable. And again, you take some breaths. You might go circle one way and then the other way. And for maybe about a minute, 90 seconds, something like that, or just simply holding them for that same length of time. And so you can do this lying in bed, you can do this while watching TV, you can do it while sitting. And make sure that when you do it, that it's comfortable, that you breathe, that you relax. Now, if this was way too complicated for you, then all I would do is just knowing the direction of the colon, simply move in that direction, like up, across, down, up, across, down, and do that for several minutes. All right, I hope that was helpful. More to come. Bye. Thank you for watching.